my name is Kayla Buckles and I'm going to be talking to you about the head to toe assessment. I know all you said was to videotape us doing it, so I would first perform hand hygiene, introduce myself, stating, hi, my name is Kayla, I'm going to be your student nurse. I'm going to be performing a head to toe assessment on you today. I'll be checking the two identifiers, which is their date of birth and their bracelet. I am looking at it on here on my computer. Explains purpose of exam to the patient. So I'm going to explain why I'm doing the head to toe assessment, why it's important for me to do it. I'm going to provide privacy, of course, by closing a curtain or putting them in their room, or just by that. Of course, I'm going to ask about health issues, history, surgery, so if they got their gallbladder out, if they had cardiac catheterizations, if they did have a cath, did they have a stent placed, any health issues such as like COPD, chronic bronchitis, asthma, if they've ever been diagnosed with diabetes, anything like that I would ask. I would ask about medications, the medications, the milligrams, and how many times a day that they take them. I would ask about allergies, especially about shellfish. I would ask about the influenza shot, and the pneumococcal if they're over 50. I would affect their, I would attest their mood and affect, their LOC, their posture, the facial expression, their breathing, to see if it's labor or not, the nutritional status diets I'd be checking to see what exactly they're intaking and outputting. I would be assessing their mobility gait, seeing how they're walking, their balance, to see if there's having any swaying or anything like that. If we did a Romberg test, I would look at their speech, their language, to see what is appropriate to speak with them, and to see what else that they possibly would need. If they are deaf, if they need a cosigner to speak to me, anything like that. I'd measure their vital signs, including their blood pressure, respiration, their heart rate. I would examine their hands for the radial pulse, checking their, since I'm down there for the radial pulse, I would check for their nails and for clubbing. I would ask them about the pain scale, 0 to 10 pain scale, 0 being in no pain, 10 being the worst pain imaginable. What would they rate their pain? I would, of course, touch the skin to see if it's wet and dry, to see if it's warm to the touch. And when you're checking for the skin, you're going to check for the color, if it's normal for ethnicity, anything like that. Checking for their cap refill, to see if it comes back less than 3 seconds. I would palpate their skull, their hair, cranium. I would actually start with that and just work my way down. Inspect their foremasses and lesions to see if they have any scars, lesions, veins, anything like that that's on their skin. Checking their facial expression to see if it's symmetrical, not to where it's on one side like that for a possible stroke or anything like that. And if they didn't, say if one eye was down like this and the other eye wasn't, you would ask if they've ever had a stroke, if they had a family history of strokes or anything like that. I'll palpate the maxillary sinus and frontal sinuses, which are up here and right in here. I would check their eyes to see if they have vision loss, cataracts, false eyes, seeing if anything is reflecting off of their pupil response. If I can do the eye test, PERLA, that's where I would do PERLA at. The corneal light reflex, PERLA. Their external eye structures, their conjunctivae to see if it's pink. So I would be pulling down and seeing if it's pink or not. I would test the size, the response to the light, and accommodation. PERLA again. I would note to see if they have any hearing concerns, and if they do, I would assess for hearing aids, inspection for the external ear, inspection of the internal ear for blockage or discharge, seeing if there's any yellow or green coming out of it. The same with their nose. checking their mucosa, their tongue, the floor, the mouth, the teeth, the gums, inspect their lips for symmetry and color, and their facial symmetry. I would inspect the neck for symmetry, masses, lesions, veins to see if they have a JVD, carotid stenosis. I'd be checking right up here with the pen light, doing the 45-degree angle. I would inspect and palpate the carotid pulse, which is on this side, one at a time. See if it's regular, rate, and rhythm. I would auscultate the posterior and lateral breath sounds, and the anterior as well. I would assess the abdominal for contour, for symmetry. See if the umbilicus is midline and inverted and their pulsations. I would auscultate the bowel sounds prior to palpating. So I'll be listening first before palpating, and then percussing, light palpation, and then I'll inquire about the eating habits. What do you eat? How much do you eat a day? Talking to them about their diet a little bit and about their bowel habits to see if they're actually having normal bowel movements. That's something we could check as well. I would inspect the color for their skin for color and ethnicity, and for temperature to see if it's normal. I would inspect the skin for masses, lesions, scars, veins, seeing if there's anything abnormal. You can inspect for edema, which is usually at the lower ankle. Sometimes it's actually all over the skin, but usually it's at the lower legs to the ankle. Checking for varicose veins or spider veins, anything like that would be good as well. I would palpate the pulses, the popliteal pulse, which is underneath the knee, the posterior tibia, which is on the inside of the calf, and then the dorsalis, which is at the bottom of the feet. I would then separate the toes and inspect that to see if there's anything abnormal with the toes. That's why you want to know if they have diabetes or not. You can see if there's gangrene or anything like that. That would be something that we would want to check. Test their range of motion skills and their muscle strength of hips, knees, ankles, and toes. I would observe the gait when possible. So I would be doing the Romberg test, assessing gait and balance. I would be doing tandem, heel to toe, walking front and back, on toes, on tippy toes, front and back, on heel to toe, everything like that. I would observe the gait when possible, so that. And the final evaluation, I would use like the therapeutic communication 100% of the time, so asking if they have any questions the whole time that I'm doing the test, maintaining modesty of patients at all times. So I would of course make sure that they're always private. I wouldn't say anything to anybody else about it, but yes, just to see if they had any questions or concerns. If there's any other questions that I could possibly answer that they don't already know about, or even if they did know about and they wanted to talk to me about it, that would be great. I can do that as well, but that would be my full head to toe assessment.